Okay. Hi, Ms. Sikowski. My name is Ashley Maraldi. I'm a Seattle Pacific University nurse practitioner student. And I'm just going to go ahead and conduct an interview today and see what brings you into the clinic. So what's going on today?
Well, I have noticed that it's harder to get started when I urinate. And it's gradually gotten worse over this last year. And especially for these last 3 months, I'm just having a heck of a time.
Okay. Now, you said that it started about a year ago. Have you seen anybody in the past year to deal with this?
No.
Okay.
Nope, I haven't seen anyone.
Okay. Hello. Okay.
Hey, actually, you know what? The doctor checked my prostate 2 years ago.
Okay.
Yeah, and said that it was slightly large, but okay.
Okay. 2 years ago.
Yeah. I mean, for the last 5 years, I noticed I get up at night more to urinate, but nothing like this.
Okay. So, 2 years ago when you had your prostate checked, was that just a kind of an annual regular exam? You didn't go in for any particular reason? It was just an annual regular thing?
Yeah, I mean, I guess, I had just went in because this is on and off for the last 5 years. I noticed that I get up more at night to urinate. And then I went in, and at that time, the doctor checked my prostate.
Okay. So on and off, you've been getting up to urinate in the middle of the night for the last 5 years.
Yeah, that's for the last 5 years.
Okay. So is that still going on as well now, on top of this difficulty getting started to urinate?
Yes.
Okay. Okay.
I know, I'm all jacked up.
It's all right. That's what you're here for. So, any other symptoms? So you're getting up in the middle of the night frequently to urinate.
Yes.
And you're having trouble getting started.
Yes.
Okay.
So you can just imagine how much sleep I'm losing.
Probably not a lot of sleep you're getting.
No.
So, I guess my question would be, what time do you go to bed at night?
I usually go to bed about 10 o'clock.
Okay. And what time do you get up in the morning for good?
62-year-old like me, retired, I get up about 7 o'clock.
Okay. And how many times do you think you get up in the night?
Oh gosh, let's see. I mean, about every hour.
Okay. And how much would you say you're urinating when you get up every hour? Just approximation.
Not very much, just a little bit.
Okay. Okay. All right. And is this every single night is the same this way?
Yep.
And every single time you urinate, it's hard to get started?
Oh yeah.
Okay. Any pain when you urinate, or any pain in general?
No pain, burning, or urgent feeling to go. Nothing like that.
No burning.
Nope.
And no urgency.
Nope, no urgency. And no pain, thank God.
Yeah, that's a good thing, I suppose. So, all right. So no pain, no abdominal pain.
Nope, I don't have any pain.
Any blood in your urine at all? No. Okay. And does anything make this better? Does anything relieve these urinary symptoms? Does anything help you get sleep, or does anything make it easier to go to the bathroom?
Okay. Well, so I cut down on fluids and caffeine.
Okay.
But that didn't help.
Okay.
And, I mean, if I drink too much, I feel like I have to go all the time.
Okay.
So that just makes it worse.
Okay. Okay. All right. So this is constant. This is not an intermittent thing. This is all the time.
This is all the time.
Okay.
I think that it is.
Right.
Like part like
And 2 years ago, your doctor said your prostate was a little bit large,
Yep.
but that it was okay at that time. Did he instruct you to follow up in a certain amount of time, or did you guys have a plan of following up, or?
No, I didn't really check up on it.
Okay.
I mean, I can jump around and make it so there's something.
So is 5 years ago when you first noticed this, and before that you were pretty healthy? Have you had any previous urinary symptoms?
No, you know, my usual health is very good. And as far as this, I mean, just the having to urinate more at night, that's been on and off for the last 5 years, and the prostate.
Okay. So besides interrupting your sleep cycle, has this interrupted anything else in your life? Do you find your daily living activities are interrupted at all?
I mean, I just better be near a bathroom.
Okay. All right. Well, I'm going to go ahead and I'm just going to ask you some questions about your past a little bit, just kind of your social history, and just kind of get to know you a little bit better.
Okay.
So, how's your diet? Would you say? I mean, I know it sounds like you try to not drink a whole lot of fluid, but how would you say your diet is on a day-to-day basis?
Well, my diet is actually, I'm actually a pretty healthy person. I eat 3 meals a day. I don't do too good on the snacks, so for the most part, the 3 meals a day. And usually breakfast is really late.
Okay.
Do you incorporate 2 methods?
And would you say that you get a good amount of fruits and vegetables in your diet?
Yeah, I eat a serving of fruit and vegetables with every meal.
Okay.
Trying to think.
And how about whole grains? Do you find you're getting a lot of fiber in your diet, or whole grains?
Oh yeah, I get a lot of fiber through the veggies, but as far as whole grain, I try to stick away from that.
Doing like micro circles. Yeah. Just eat light, medium.
Is there any reason for that, or do you have a sensitivity to it, or just preference?
Just my preference.
I do.
And how about fast food? Do you find yourself eating out a lot, or fast food?
Nope, I don't do a lot of fast food.
Okay.
But like what Jessica talked about.
And you mentioned that you cut back on the caffeine because of the urination difficulty.
Well,
have you cut it out or just cut down?
Well, it's about 3 cups a day now. I used to drink the whole pot each day.
Oh, well, that's good. All right. What about, speaking of beverages, do you drink alcohol at all?
No.
Never, just don't like it?
Nope. I don't like that stuff.
Right.
Okay. And how about tobacco? Do you smoke cigarettes, chew tobacco, pipes, anything like that?
No, I don't do none of that stuff either.
Okay. And how about any illegal street drugs or anything like that?
Nope.
Okay. So sleep patterns. We've, I think, covered that thoroughly.
Oh, yeah.
And do you find yourself having to nap during the day because you're not getting a lot of sleep at night, or do you just kind of deal with being tired?
I take a nap here and there.
Okay. How long would you say they are?
About 30 minutes.
Okay. And are you married?
Yep.
Okay. So you sleep in the same bed as your wife?
Yeah.
So she's got like her leg over.
If she gets on my nerves, I'll go to the reclining chair.
Okay. Okay. And I ask this question to everybody, but I just have to ask, do you feel safe in your home? You've never had any history of abuse as a child? Your wife isn't abusing you?
Oh, no,
Okay.
none of that business.
Okay.
Even maybe the infrared clavicular.
Okay. And how about as far as exercise? I imagine it might be a little difficult exercising with this problem, but do you get a decent amount of exercise on a day-to-day basis?
Well, I'm not too active. Not like I used to be.
Okay. So for female,
How many times would you say you exercise a week?
Oh, 1 if I'm lucky.
Okay.
lift
And how long would that be for? What type of exercise would you do?
Maybe about a 20-minute walk.
All right. And did I hear you say you were retired?
Oh, yeah.
Yeah. What did you do before you retired?
I was a mechanic.
Mechanic. How long were you a mechanic for?
Tell her when I'm going to touch her ass for permission.
That's a good question.
Too many years to count?
Too many years to count.
All right. Were you exposed to any sort of occupational hazards in your work when you were working?
Nah.
Okay. All right. So since you're retired, have you been able to do any traveling?
No.
No traveling in or outside of the U.S.?
No recent travel.
All right. And what was the highest level of education you received?
Well, I got my high school diploma.
Okay. All right. And are there any religious or cultural beliefs that you'd like me to be aware of?
No, just regular old Christian.
Okay. And any practices that you'd like me to know of to help with your care, providing your care, or
no.
any special preferences? Okay. All right. So retired, and do you have health insurance?
Yes.
Who are you insured through?
You asked some difficult questions. Group health.
Okay. I need to get the full picture.
No problem.
Okay. So I'm just going to kind of run down here and make sure we've got everything, okay?
Okay.
So you're here today because for the past 5 years,
Yes.
you've been getting up in the middle of the night to go to the bathroom.
Correct.
The past year in particular,
Yes.
you've been having a hard time getting starting your streak.
Oh, yeah.
Okay. I just want to touch on that a little bit. Do you feel like you're having to strain when you go?
Oh, yeah. You know, when I have to go pee, it feels like I have to push against something to pee.
Okay. Okay. And after you've gone, do you feel like you've relieved yourself, or do you feel like you still are full of urine?
Oh, I still feel like I have to go pee.
So we talked about how often you think you're peeing in the middle of the night, but during the day, if you had to guess, how often would you say you're going to the bathroom?
Whew, every hour.
Every hour. Okay, so, all right. So, past year, you've been having trouble getting started.
Yes.
And then it's just been gradually getting worse.
Yep.
And in the past 3 months, you've had a really hard time with it.
I'm just having a heck of a time.
Okay, so the straining's just worse, and you're having to feel like you're meeting more resistance.
Yep.
Okay.
Got it.
And any other symptoms that you can think of that we haven't touched on? You said no blood in your urine, but you haven't had any fevers or nausea or vomiting.
I've never had any fever. No chills. My urine still looks the same.
Okay. Okay. Any odor to it?
Nope.
Okay. What do you think is going on?
Well, you know,
As I'm sitting down,
I just hope I don't have prostate cancer. I guess prostate cancer is pretty common.
color of the skin, any lesions.
All right. And is there anything else that you'd like me to be aware of that we haven't talked about today?
Nope. I'm all right.
Okay. Well, let's do an exam and see if we can figure out what's going on.
Okay, thank you.